Hey guys, so I wanted to talk about mental health today and what it means when you're preparing for surgery. So, mental health tends to be an issue that most people who are obese also struggle with. It's not always clear whether it is caused by the obesity or whether the obesity is caused by the mental health issues. Which comes first isn't clear. But regardless, just like your weight won't change without some kind of intervention, your mental health also will not change unless you do something to address it. So let's jump into it. So, if you are going through the process of trying to get bariatric surgery, one of the things they will probably have you do, and probably towards the end of the process, is a psych eval. Don't worry, it's not as scary as it sounds. Basically, they just want to make sure that you don't have any mental health issues that would make your bariatric surgery less effective. So having said that, if you do have any unaddressed mental health issues, it would probably be in your best interest to get those addressed before you go to your psych eval, because they will probably ask you to address those before they give you the green light for surgery if you haven't addressed them by your psych eval. So basically what I'm telling you is, regardless of where you're at in your bariatric surgery process, even if you're just getting started, it's in your best interest to start therapy. If you have any unaddressed mental health issues, start working on them now. It can take time. And to be honest, if you have any food-related health issues, like if you're bulimic or anorexic, or if you have a food addiction, you definitely want to get those addressed and start working on them before surgery, because they will cause you issues. Not only will it make it harder for you to pass your psych eval, but it will also, if you get the surgery and pass your psych eval, it will make your surgery less effective. Having said all that, it is possible to use food as a coping mechanism and not have a mental health issue related to food. Something as common as generalized anxiety disorder or major depressive disorder can actually cause you to lean on food as a crutch. And that is exactly the kind of thing that you'll want to address before even approaching the idea of surgery. Now, for a harder topic, your surgeon is going to want you to be clean and sober before they agree to do your surgery. I'm not exactly 100% sure on the timeline, but I'm pretty sure your doctor is going to want you to have no alcohol, tobacco, or any recreational drugs such as weed or even Delta-8 in your system for at least 6 months before and 6 months after surgery. Now, if you feel like you cannot go without alcohol, tobacco, or recreational drugs of any kind, it might be in your best interest to seek out help. You can always go to a family member, friend, or even a professional that you trust and tell them what you're going through. You don't have to go through it alone. And if you don't know who to go to, call this number on this screen. You will get a hold of the SAMHSA National Helpline. It's free, and they can help you get in touch with the right people for substance use treatment and information. Obviously, addressing issues like this are not easy and it takes time, so be patient with yourself and be kind to yourself. Give yourself the grace to get better. Don't rush it, and if it takes longer than you wanted it to or than you planned for it to, don't beat yourself up. Last week, I said that the first step to this process is to ask the right questions, but after making this video, I have realized that that should honestly be the second step. The first step is making sure you are mentally stable enough for this surgery. You want to make sure you're mentally as healthy as you can be before you even start the process of getting this surgery. And if you have started the process, it's not too late. You can put it on pause and make sure you are mentally sound. And you really should. After all, you want to make sure your foundation is as strong as possible before you start building. So that's going to be it for today. I do have one more video on preparing for bariatric surgery, but it will be the Monday after next when I post it, because next Monday I am going to do a short little update on my own weight loss and recovery and just some general things that I'm going through. But yeah, I hope you have a great week, and thanks for watching. See you next time.